From the studios of the Department of Communication in Phillipsburg, welcome to Prime Minister Talks with Honorable Prime Minister Silveria Jacobs.
Welcome to Prime Minister Talks. This is Silveria Jacobs, and I have a special guest with me today in my, let's say, quest to ensure that the people of St. Martin are as updated and educated as possible as to our current situation, especially as we're dealing with an outbreak of the COVID-19 virus. With me, I have Antonio Pontiflet. He is no stranger to the people of St. Martin and a longtime employee at the St. Martin Medical Center. Welcome, Antonio, Mr. Pontiflet, and please tell our viewers a little bit of what you do at the medical center.
Good afternoon, good to be here, and good to give the message again and again and again until we all get it right. I'm Antonio Pontiflet. I'm Manager Patient Care and Education at the St. Martin Medical Center. Been there for now the past 22 years, and also very instrumental in the COVID, the pandemic, and the care for patients at the St. Martin Medical Center, and also instrumental on giving lectures and talks about COVID and how we should go about it, because we too have a role. Not only the healthcare personnel, but you as a person have a role. We all are healthcare personnel when it comes to COVID.
Thank you, Tony. I mean, look like you're a natural in this venue. So again, welcome to Prime Minister Talks. And hopefully we can have repeated, a repeat of today as soon as time permits for both of us to keep the population involved, because as you mentioned, education is part of your portfolio.
It's the key, yeah.
Okay, so currently we have a current patient care policy. Can you tell us a little bit about the patient care policy at the medical center?
You have the current patient care policy is how are we going to inform and how you're going to care for the patients coming in, but also how you care for your staff. So the patient care policy that we have from time COVID started is to limit the income of patients or visitors to the hospital. By informing the patients, informing the people of St. Martin, they too can test themselves and know when to come to the hospital. So you don't make those unnecessary voyages to the hospital thinking, well, it is time to be in the hospital and you have to go back home. That's why we have one of the key factors is take care of yourself. And how can you do that? By using your mask, social distancing, avoiding a bunch of grouped areas, so that, and the most important one is keep yourself tested, test on time, report on time. Government has done a wonderful job by having CPS involved. CPS is working hard. Report on time to CPS, because what we notice many times when they come to the hospital, it's already too late. And then people think that, oh yes, from COVID, everyone is going to die. It can happen, but we have a role to play. The role to play is be on time, checking yourself, and know when to indicate that, hey, things are not going well. And one of the key things that we have besides that, we had to take nurses from the different wards and put them to work COVID. Because we noticed that when patients come to the hospital, if they see you walking in green, they know you are a COVID nurse. They don't want them. We also had patients who were scared to come to the hospital. So what they were doing, they have an issue, they don't come to the hospital, they come last minute to the hospital. Then you had hypertension, but now you come in with a stroke. Why? You did not call on time. So the natural thing that you do if you're sick is let your family know I'm not feeling well, so that they can get to the hospital on time or get to your GP on time. So that is what we do. What we also have in place is we don't leave anybody coming to the hospital. You don't know who's bringing the virus and who's taking the virus. So that we have a whole questionnaire. When you come to the hospital, they will ask you the questions. Do you have COVID? Or do you have someone who came from abroad by you? Do you have any flu-like symptoms? And what we notice, people will always be people. You have some who's going to be honest, and you have some who's not going to be honest, because they know if I say I have flu-like symptoms, I may not get that appointment right away. So we have cases where people decided that, let me say
no.
And then what happens is they reach to the emergency room, and there it is, yes. Or we had instances where people were in the hospital who stated that they didn't never have flu-like symptoms, but then they tested positive. So that's why people have to be honest with yourself. And by being honest with yourself, you're already taking care of yourself.
So is the hospital now taking more measures to test persons before allowing them to enter the hospital?
From last year, in the beginning of COVID, that is what we were doing. And then when we saw the numbers, so once the numbers were going down, we said, well, okay, you don't have to do it because it's a costly something. At a given moment, everyone come to the hospital. You cannot tell them you're going to do a PCR test and then you have to pay. So that's the hospital account. So now, when we see that going up, especially nowadays, current, definitely, we're not taking any chances because, again, people are scared to say that they have COVID. COVID, for some people, is a stigma.
Right.
And they don't want their people to know. So that's why we said, no, you come in. First, it was only emergency room cases that we will test. But now, even polyclinic, or if we don't trust someone, we test them. We have to because they're always one or two slip away.
Okay, so I am one of the proponents of, I'm sorry, people are not going to like this. Anybody who's coming into the hospital, part of CPS's recommendations is that you protect the high-risk persons, and persons in the hospital are at the highest risk in hospital. So that means you already have underlying issues. So I think in the interest of protecting those people, that as government and hospital, that we need to put probably even legislate stricter measures to be able to enter the hospital, as we are seeing happening around the world.
And that's why we are downscaling also.
Yes, I understand that. So we have a lot more to talk about, but we've come to the end of this first segment, and I will be right back where we will get more into some of the other measures the hospital has in place and the effects the downscaling of measures or the downscaling of procedures has on the population. Come back. This is Prime Minister Talks.
Prime Minister Talks with Honorable Prime Minister Sylvia Jacobs.
Gen yon maladi nan le monde entier ki rele coronavirus ou bien COVID-19. Li bay problem respiratoire. Sa pou n'kembe nan tèt nou se ki jan pou n'proteje tèt ou ak fami ou. Kontrole santé ou pendant 14 jours si nou te voyaje kite peyi ya. Sou vin développer la fièvre, wap tousse ou bien gen difficulté respirer, rete la kayou pas sorti. Rele docteur sou gen numéro téléphone docteur. Pratike façon hygiénique pour tousser ak pour laver main. Éviter entrer en contact avec moun kap tousse ou bien kap esterne. Sou gen nécessité assistance médicale, rele avant. Explique docteur ou bien département urgence lan ki jan senti ou. Explique yo si ou te voyager. Explique yo si ou pense ou te entrer en contact ak yon moun ki peut-être te exposé à virus lan. Pour plus d'informations, rele 914. Annonce publique sa sorti dans santé, contrôle ak prévention maladie et gouvernement Saint-Martin.
Prime Minister Talks with Honorable Prime Minister Sylvia Jacobs.
If you're just joining us, I'm here talking to Antonio Pontiflet, the manager of Patient Care and Education Department at the St. Martin Medical Center, who has joined me to give some information on how St. Martin Medical Center is dealing with the virus itself, the role he plays, but then there's a bit more that he's going to tell us that might surprise some of you, and I think hopefully encourage you to take even better care of yourself. Tony, we were talking a while ago about some of the measures the medical center has taken because of the resurgence of COVID cases. You mentioned scaling back. Can you tell us a little more about that?
We are scaling back also with the patient care. We are scaling back with elective surgeries. So elective surgery will be put on hold until we are just looking at the numbers. Because if you have so many cases out there, you got to take a 10% that can be admitted. And from that 10%, you could take a next 3% that are going to be intensive care patients. Ooh. So we are scaling back on that. So right now, the normal non-COVID, non-routine patients, we've scaled back on that. And that was also our motto in the beginning. But now we notice that this is a reality. Because if we look at the amount of COVID patients that are coming in, thank God we decided to scale back in advance. Because now you have to use those same areas. We have the ACF doing a wonderful job with the team of MI. And in the beginning, they were not that busy, but if you look now, they could have 6 patients on a ventilator, and up there have 16 beds, and whereby they used to have 6 patients. Now you notice that they have up to 8 or 10 patients in it there. So we have to take the brunt. Everyone that comes now have to come to St. Martin Medical Center. We have made offices and rooms that you couldn't put patients. We have rebuilt those to put patients in, and had to modify a lot of areas.
Okay.
And one of the next thing we did is the visitors. We also cut down on visitors drastically. Once the COVID cases are going up, we are going down with visitors.
Okay.
Again, you cannot control who all is coming to the hospital and who's coming in and out. And everyone tried to get in. But now what you notice that it's on the rise, and people now, they're scared to come to the hospital. Remember, a hospital is a place where you get all the kind of acquired infections and things. And COVID is no different to any other infection.
It's a super infection.
Yes.
All right, so we're happy to hear about that. Of course, it's unfortunate that some of the it might be elective to the medical professionals, but a person who has waited long for an appointment, etc., is being inconvenienced by the high surge of cases. So that's a risk also to health. We're trying to mitigate persons from, and the fear that they have because of the stigma from not coming to the hospital on time. So I think that fear is something that we need to address, because we don't want persons who need to visit a hospital to not come
to the hospital
and end up dying as a result.
Yeah.
So then it's not a COVID death, but it's because of COVID that the person didn't seek help in time as well. So I'm appealing to the people of St. Martin, get help on time, ask your general practitioner, your house doctor as we call it, as many questions as you need to understand your symptoms, and follow the directions and get help when you need it as soon as possible. We have not reached the point that we cannot take care of emergency cases, and so therefore I encourage you to do that. Now, Tony, besides, as I mentioned, a bit of a surprise for some who may not know, you yourself contracted COVID-19.
Yeah.
So you're a survivor, and a survivor that had underlying issues?
No.
No, you were healthy before. But as a result of COVID-19 issues. And I think that is a part that hasn't enough been shared with the population. And so I thank you for coming on to share your story with us.
Well, I worked COVID. From the time COVID started, I worked COVID. I was in COVID, in and out, clothes on, clothes off, and changing everything. I worked COVID. And I saw COVID from day one. If the first COVID cases that we had was patients coming in with diarrhea, and we thought everyone is going to be on a ventilator. And when we got it, we're like, this is not COVID. This is patient with diarrhea. So, but we worked it. And never got COVID. Our staff who worked COVID never had COVID.
Wow.
None of us were infected.
With the good, changing
of
the...
your donning and doffing of your PPE gears, we didn't have COVID. Until I didn't see a loved one of mine in Aruba for almost 2 years. And so we decided, something, we have to go. We went to Aruba, me and my wife, and when we came back, nothing. Nobody had any kind of problems. And one day my wife, she started sniffling, and she said, I got some of the sniffles. I make a joke, we'll go test. So she went, she tested, and she came back positive. Then the hygienist at the ward said, Tony, and something, then you got to quarantine, you can't be in the room and whatnot. She said, you test also. So I went, I tested, and I too was positive.
Wow.
But no signs, no symptoms, no problems, absolutely. If you had told me, go work, I would have gone to work because
You didn't feel anything?
Nothing. What we did from time we heard was positive, that some of my staff, they brought things to steam and everything. So we were doing that, steaming and enjoying it. Until 4 or 5 days after tested positive, I went to sleep. And when I got up, I was under diarrhea.
Wow.
I just had diarrhea. And diarrhea is not like you could hold it up. It just can't hold it up.
Wow.
So I put it that, something? I ate something, and now
I'm having a
reaction. And this happened for 3 days.
Wow.
And being in the medical field, I knew exactly what to drink and what to eat and whatnot, and that I was doing, but it was just rushing, until I conk out on the toilet.
Wow.
And conquered. And my wife knew exactly who to call. She called a colleague of mine, and they get the ambulance and get me to the hospital. And today I only tell you what people tell me. I can't remember the 2 weeks that blocked out. I can't remember anything.
Wow. So you were 2 weeks in hospital.
I had 8 days in the hospital. Yeah. When I reached to the hospital, they thought, well, he's going to go on the ventilator for sure. He's going to go on the ventilator. I didn't end up on the ventilator, thank God. But my kidneys were gone, dialysis had to set in and everything. And this is very important because the question people are asking you, are you known with hypertension, those things? But there's also what my philosophy is that you know, when people say it might be a pre-diabetic, might be a pre-this and a pre-that. COVID does make pre into post. Mm-hmm. COVID gets in the weakest link in your body, and that is going to inflame it.
Wow.
And as the doctors and everybody said, they say, you had luck. I think it was God that I didn't end up on a ventilator, because when they look at my lab results, I had to be on a ventilator.
Oh.
So for me, I say it is luck. I think it was prayers. It was definitely prayers.
Wow.
And coming out of it, it is an experience that I had. For me, I always say I worked COVID and I lived COVID. And I know now but I still didn't go through the experience what I saw some of the patients went through when it touches the lungs. That people cannot breathe, that people are begging you, listen, just end it.
Wow.
Cut the life. I can't breathe anymore. You don't have something to make me sleep, and if we give you something to sleep and you already cannot breathe, that's it.
Yes, it relaxes your breathing too.
So for me, I don't have the memory what happened in those 2 weeks, but I have patients who have been in the hospital, been on ventilator, that they are traumatized up to today of the fact that they couldn't breathe or gasping for breath.
Right.
And that's why I tell the people of St. Martin, you have to take this serious, because you don't have an idea of what's going on. That's why you could be very lackadaisical. But if you see how people are suffering, you will not choose. You will see in something, let me get vaccinated so I too don't have to go through that, because they do suffer. I've seen it. I have had COVID, but I didn't suffer as those persons.
Wow, this is a story that really touched me. I know Tony personally, and when I heard it, I was thrown back. And when I heard also the way it went, he could have easily stayed at home and passed away, because having diarrhea for multiple days dehydrates you. You don't know the extent. And when we come back, I do have to take a break. We're a little bit over. We'll be coming back to how dangerous it can be to remain at home when you're seriously ill. This is Prime Minister Talks. Please come back.
Prime Minister Talks with Honorable Prime Minister Sylveria Jacobs.
The following public service announcement brings to you a few of the many unsung heroes in the medical profession who are working tirelessly to put our needs ahead of theirs and in the midst of this battle to prevent the spread of COVID-19. Listen closely to their message so that we all can remain safe.
Hello, my fellow St. Martiners. I am Nurse Carty from the Ambulance Department. We are now facing a very crucial time. Please adhere to the instructions given. Follow good hand hygiene, social distancing, and please stay at home.
My name is Angelo Martina. I'm one of the supervisors of the emergency room. Let's fight this. Stay home.
I am Dr. Sameh Nadari. I am internist at St. Martin Medical Center. I am here for you. I am at work for you. So please stay at home for us.
My name is Andrele Ellis, pharmacist of Kale Pharmacy in the St. Martin Medical Center. Please stay home.
This public service announcement is brought to you by the St. Martin Medical Center and the government of St. Martin.
Hay un brote de enfermedad respiratoria en todo el mundo causada por el coronavirus COVID-19. Tenemos algunos consejos de salud que debe tener en cuenta para protegerse y proteger a su familia. Controle su salud durante 14 días después de viajar. Si desarrolla fiebre, tos o tiene dificultad para respirar, quédese en casa y notifique a su médico. Después de toser, proceda a la higiene de las manos y evite el contacto cercano con personas que tosan o estornuden. Si necesita atención médica urgente, Asegúrese de llamar con anticipación para informar su estado de salud antes de visitar a su médico o a la sala de emergencias. Notifique de sus síntomas, historial de viaje o si cree que estuvo expuesto a una persona con COVID-19. Para información adicional, llame al 914. Este anuncio es dirigido a usted a través del Centro de Servicios Públicos por el Control y Prevención de Enfermedades y el Gobierno de San Martín.
Prime Minister Talks with Honorable Prime Minister Sylvia Jacobs.
Welcome back to Prime Minister Talks. Today we're having a discussion with Mr. Antonio Pontiflet of Patient Care and Education Department, St. Martin Medical Center, COVID-19 survivor, who was just telling us about his experience, and he segued right into his promotion of the vaccination. He got ahead of me there. So we're going to backtrack a little bit to, Tony, were you vaccinated when you got infected?
Okay. I vaccinated. I had my first vaccination, and it's a week later that I got infected. A week later I got infected. No, 2 weeks later I got infected. And I have a philosophy. My philosophy was that if I didn't have maybe that first vaccination, I think it could have gone worse. Because I've seen what I'm seeing now. I'm seeing persons coming in without the unvaccinated, and they're getting both the lungs, the kidneys, the liver, everything is being touched. It's like a multi-organ failure is going on here.
Oh, wow.
So,
and the vaccinated persons?
And the vaccinated persons. We have to realize that the Delta variant is a variant
more rigorous.
That is rigorous, right? It's a breakthrough any wall. So imagine if it's touching the persons who are vaccinated, what will it do to you who are unvaccinated? Yeah.
But mostly what we gathered from the data was that even the vaccinated persons were persons who already had underlying conditions as well.
Yeah.
So that also puts you at a higher risk level.
It puts you at a higher risk level. And being vaccinated does not mean to say you cannot get COVID.
Say that to the camera, please.
You cannot. Being vaccinated does not mean to say you will not get COVID or you cannot get COVID. Let me take it back further. Your babies, you're taking your babies to the doctor's clinic and they're getting the MMR, the measles, the mumps vaccination.
Polio.
But we know that we have people who get the mumps. We have people who get measles. We also have people who die from the mumps and die from measles. If they were not vaccinated, you may have up to 80% dying from mumps and measles. But
correct.
Because they are vaccinated, you don't have that amount. You got about a 4 or 5%. But, so it's to show you that the vaccine does not prevent you from getting it, but it helps you not to get worse, that you don't end up, the mortality will be less. And that's why we also have to treat this vaccine as such. And I think we have the proof. The proof is for those persons who have been vaccinated and get COVID, check the difference if you were not vaccinated. The proof, we have the proof. A lot of people do all kind of research, but we who have had COVID, we are the researchers. We have the proof.
The stigma that is still there. I've recently been exposed in a sense of someone who was in my area, spent time with me 2 to 3 hours. The following day tested positive, and everyone who was in the gathering at the time, though it was a small gathering, was in a panic. But one person in the whole group was not vaccinated. We notified, they said the vaccinated persons just need to monitor themselves. And of course, you know, if you have to go out, wear a mask, do these kind of things. Everybody monitored. Test in the first 3 days. After the 3-4 days, majority, if not all of us tested, and everybody tested negative. But just the few days of not knowing can put a lot of stress on you.
Sure.
Another case I saw today, over the weekend, just the thought that they were exposed to a positive case, the person had headache, the person feels nauseous, and I'm like, I can't use headache as a gauge, and that's something that is now prevalent as well with Delta. A lot of people are saying the first thing they experienced was headaches. Are you noticing anything like that? And what can we do to encourage people to come forward and at least be tested to rule it out?
it is a stigma to a lot of people, especially before time you had CPS coming to your house. I knew of persons who told us that they hid when the CPS reached because they don't want the neighbors to see CPS coming to their house. And now it makes it easier because now you have to call. So a lot of them would not call CPS because they don't want anyone. They have people telling me, oh yes, I'm in quarantine. No, you're in isolation, you have COVID. They will tell you, I'm home in quarantine because I was in the air with someone who had COVID. That time they have COVID. I think people have to look at this, take it serious. It is good to be able to, I'm sitting down here talking about it now, but we have many of others who lost their lives, especially those with comorbidities, underlying issues. Take it serious. Speak to your doctor, see if you could get tested. Because if you get the vaccine, we have not have proof that the vaccine kills you with your underlying areas, but we have proof that COVID kills you with your underlying areas. So you have to determine how you're going to go about it. Keep the stigma aside. Get the stigma aside and put it in your mind that I'm going to be very egoistic. I got to help myself first.
Well, I must say it has been a bit of a, how you call it, roller coaster with COVID over the past year and change. We have actually fared better than we expected in the first couple waves. This last wave is taking a toll in terms of deaths. We have had, I know what Minister said on Wednesday, 8 deaths in 9 days. That was very, very hard. But I have said to the people, 40 deaths is 40 deaths too much.
Too much. That's right.
So we're coming to the end of the program, but there will be more opportunities for us to share with you, share information with you. But I'd like to take this time to honestly encourage people to look good at the data. 95% chance protection is a chance I will take. I have taken. And thank God I've been exposed twice in the past month to a person that has been positive and both times tested negative. I mean, tomorrow I might not be so lucky, but what I'm doing is continuing to wear my mask at all times, especially when I can't be. And if you check between Tony and myself, we got 2 meters distance. We are not within the space. None of us are exhibiting any flu-like symptoms to cough on each other. So protect yourself. Ensure that you are protecting yourself first at all times and get healthy. This is something we preached last year. Get healthy, and in the next few episodes, we'll be focusing not only on bringing you information about COVID and what can happen to you, but ways for you to get healthier. So this is Prime Minister Jacobs signing off for today and wishing each and every one a safe weekend, but also continued protection for yourself and your family. Look up our websites, get vaccinated, and get tested as often as you feel you've been exposed so that you can protect others, because some of us are asymptomatic and still able to spread this virus. Thank you for following this program, and until next time, this has been Prime Minister Talk.